Hi, I'm Steve. You can call me Steve. When I was first conceived, I was a tiny blob of undifferentiated cells. I didn't have anything that looked like muscle or bone or nerves or whatever. As I developed, those cells began to convert into specialized tissue that makes up my body, my skin and my organs, and all the other types of cells that have a specific purpose. Those original cells are called stem cells, and their entire purpose is to turn into different types of cells. Has anyone played StarCraft? You know how the Zerg grow all of their units from those little larvae that hang around at the main hatchery? More or less the same deal. Stem cells come in two broad types, embryonic and adult. Adult in this case means someone who's been born, not someone who's reached physical maturity. Adult stem cells can be used to treat a number of conditions, but they're hard to harvest and not very versatile. A lot of them are found in your bone marrow, which requires drilling into your bones to get it. Others are in your fat or your blood, which are easier to get at but still require invasive poking to harvest. There are also stem cells found in umbilical cord blood, but you have to wait for somebody to give birth to get those. The downside is that these adult stem cells can only be used to treat disorders in tissues similar to what they were harvested from, because they can only turn into cells similar to where they were found. The defining characteristic of adult stem cells is their limited versatility, although recent discoveries may allow us to play tricks and expand their use. Still, for the foreseeable future, their applications are rather limited. On the plus side, you can harvest stem cells from a patient, culture more of them, and then use them to treat that same patient. Since you're using that person's own cells, there is zero chance of their body rejecting them, unlike when you're transferring tissue between different patients. Embryonic and fetal stem cells, on the other hand, are much more versatile. Their job is to build a complete body from scratch, so they can turn into all the various types of cell found in that body. This means they can be used as a treatment to repair any type of tissue in an adult body. However, they're harvested from embryos, which are usually obtained through abortion. A lot of conservative-leaning jurisdictions have imposed limitations on what research can be done with them, and in some cases, outright bans. The ethics of this situation are complicated. My scientific background does not include any courses on scientific ethics, and that's true for most other scientists as well. This is not something that I can speak on with authority. However, in the description, I have linked to a nuanced post by philosopher and scientific ethicist Dr. Janet Stemwedel on the issue. It's informed my own understanding, and I highly recommend reading it. Okay, so what can stem cells do? The big one is leukemia, or rather, repairing the side effects of leukemia treatment. Leukemia is a form of cancer, and the radiation that destroys it also destroys the stem cells in bone marrow. Fresh cells from a donor are injected into the middle of leukemia patients' bones to replace the ones they lost. Bone marrow transplants have been in use for over 30 years, long before the concept of stem cells was on the public's radar. There are a few other treatments based on transplanting specific types of stem cells from an adult donor, but so far, most applications are in the research or development stage. Some of the more exciting applications involve using stem cells to regrow tissues that don't normally heal in adults, like brain tissues or spinal cords. Both are made up of nerve cells, and those are notorious for not regenerating if damaged. Currently, if your spinal cord is cut, you permanently lose all voluntary control of muscles below the point where it was severed. If your brain is damaged, that can never be repaired. In extreme cases, the person you were might be gone forever. Stem cell therapy isn't a magical cure for that, but research has shown promising results in partially reversing the effects or alleviating some of the peripheral symptoms and discomfort. Further research will build on this and deliver better results. This is why research funding is so important. Currently, most of the benefits of stem cells exist only as potential, and a lot of work and money are required to translate that potential into reality. That's stem cell therapy. It's not a miracle cure-all yet, and it's also not an evil, baby-murdering massacre perpetrated by amoral scientists as some of its opponents claim it is. There are ethical issues to consider, and like all research involving human subjects, it requires oversight. However, that oversight should be informed by data and rational, measured policy, not by the knee-jerk reactions of the anti-science mob. Thanks for watching. I've been Steve.